the issue of interprofessional education in Czech Republic is not established. I have to say there's nobody who is concentrated to this topic, unfortunately, because in West Europe, I guess it is 30 years already, there is a lot of universities where this subject, interprofessional education, is established, or there are also some universities where is department for interprofessional learning. Why I am thinking about this topic a couple of years already is that I'm teaching with my colleagues in medical faculty, where is as well a study for bachelor students, and majority of the students is from nursing. And after study a lot of studies and documents about this type of special learning, I was thinking that we could try something, and we should start to develop a very much problematic topic, which is communication inside the healthcare team, which is really, I guess, necessary to do something with this problem, which patients, our patients feel very much problematic. My idea was to start with a couple of experiments. One was to put together students of medical studies, medical students, with nurses which are studying nursing curriculum. We tried this and we arranged one practicum where medical students had some practical skills, preparation for the hospital, we say introduction to clinical medicine. And we brought nurses, students of nursing there, and there were a couple of topics. One was about application of injections, and nurses were showing this procedure technically, and medical students could bring some knowledges about anatomy, about physiology, and they were discussing together, and of course they will learn each other about one practical skills. Another practical skill was about measuring of vital signs, and medical students were talking about how the sphygmomanometer functions, what is necessary, or what is important to listen, and the nurses were showing what is necessary if you are measuring this vital signs on a real patient. I mean real steps the patient should sit or lay, that you have to put the calf 5 centimeters above the cubital area, and etc. etc. And they were again learning from each other. The profit from this practicum was for both groups. Medical students enjoyed practical skills, and nursing enjoyed more knowledges about the functions of this body, functions of body, or functions of some technical material. Another effect of this learning was that they realized that they are two different groups, but they have the same goal, the good quality care of patients, and they cannot. This is necessary to shame or to be afraid that the some group knows more, or we should not ask this, we should not normally communicate. And we of course said to this group of students that they should learn also communicate inside the healthcare team, because this is the main goal, what we feel that this is necessary to learn more and more and intensively. Second experiment which we did was a seminar about one topic. It was case study about patient with diabetic foot, and we established one group of teachers. It was one physician, one nurse, nutritionist, nutritional therapist, and physiotherapist. And every teacher were talking about their field of care, and we thought that it will be very interesting to see one case of the patient, one diagnosis, and who is involved to the care about a patient. And I was very enthusiastic about this seminar, but unfortunately I have to admit, if I do some reflection, that it was not so successful. Students were not so happy from this seminar. I was talking with them what they were learn, and because they were students of the second year of medical study, medical curriculum, they were more concentrated for anatomy and physiology. They didn't care about another profession in this moment. And because it was second year, I have to admit that it is necessary to think about timing for such a special seminar about interprofessional learning. I have planned to do more, of course. I would like to do more such kinds of interprofessional learning experiments, let's say, and but it needs a couple of things to do. One important thing is to have very enthusiastic teachers. Second is to have time for very, very good and deep preparation, and to have support of management of faculty.